Welcome to another episode of Everyone's Got a Story by the Social Blueprint. Today, we're very lucky to have with us Dr. Jordana Hyman. And Jordana and her husband, John Borowski, grew up in Melbourne, and they now reside in Israel with 5 amazing children. Jordana is an obstetrician, gynecologist, fertility specialist at Sharee Zedek Hospital and volunteers at multiple organisations in several countries. Jordana, welcome to the Social Blueprint.
Thank you. It's great to be here.
Lovely to have you here. Jordana, let's take viewers back to your teenage years.
Okay.
When you were living in Melbourne.
Okay, so thank you very much. I'm really honoured to be with you guys today. I grew up, as you said, in Melbourne. I was born in Melbourne. I actually went back to the hospital I was born in for a picture for my mum, who's in Jerusalem, born in Francis Perry House, and grew up in South Caulfield. And I went to school here. I went to Yavna and then Bet Rivka. And the Aliyah part came later after uni. I was at Bet Rivka as a teenager. Not so involved in religion. My parents had chosen the school, I think, originally because they wanted me to go to a girls' school, and they thought I'd do better without the distraction of boys. But I had great teenage years. I was actually very involved in netball as a young teenager, and all sorts of extracurricular activities. I was a girl guide. Later on, I got involved in B'nai Kiva, and was sort of quite involved also in music. I think I had great teenage years, and I was very, very fortunate.
Wonderful. And I believe you married quite young?
I got married at age 23.
Yes.
About a month after my 23rd birthday, even though my Hebrew birthday was one day after my 23rd Hebrew birthday. I think in retrospect it was quite young. It didn't feel so at the time. We'd been dating. One of the people asked me recently about the proposal story. They were talking about their proposal. I'm like, we didn't have a very romantic proposal, but at one point John turned to me and said, "Do you want to change the world together?" Oh. And that was after we'd only been dating for a few weeks. So it wasn't really a proposal. It was just this sort of think about what we could do together. And really our marriage has been an amazing partnership, and we've had a lot of adventures and I hope that we have changed the world for better and continue to do so. But it took a little while from that moment to actually getting engaged and married. But you know, it was quite young, and we started a family quite young and had a lot of adventures together and shared those years that maybe some people are enjoying, you know, each at their own pace. But we got to have a lot of adventures, which I'll talk a little bit about them today. Volunteering adventures, traveling adventures. We got to do a lot of great stuff together, and I'm glad that we had the opportunity to finish our studies. We're both doctors. Yes. In Melbourne, and we both did our internship and made Aliyah after that stage. And I always knew I wanted to live in Israel and make Aliyah, but I also wanted to finish my studies. And I was quite determined that I would only marry someone who wants to move to Israel, because that for me was a deal breaker.
Right.
And we're very lucky that we met again, because we actually met as teenagers. When I was 14, John was 13, which is really, really young, and he basically had his eye on me since then. We were involved in a Salt Pillar theatre production for young Jewish teenagers. Yeah. John was the lead role. I wasn't such a great actress, so I was relegated to backstage lighting and used different kind of skills. And we had a lot of talks at the time, because John was in year 8 and he was a student at Mount Scopus, and he was deliberating, was he going to stay at Mount Scopus and was he going to move to Melbourne High, which was interesting because that actually came up in my own family with my brother around the same age. He credits me with staying at Scopus. He stayed at Scopus in the end. We used to have all these sort of philosophical discussions about Judaism, about religion, about school, and we were friendly, but I didn't think any more of it. And I remember the first time he called my house and my dad said, "It's John Borowski on the phone," and I wasn't at all interested romantically, but we kept meeting up over the years. Nothing ever happened. We just would meet randomly here and there at the movies. I used to work at the movies as a teenager. That was one of my jobs. Yeah. I earned money looking towards my trip to Israel, because I spent a year in Israel after high school, and my parents at the time didn't really want me to go. They were scared of what would happen if I went to Israel. So I said from age 15, I'm going to have a job. I'm going to earn money for myself, put it away. It's going to help fund my trip. And sometimes John and his friends would come to a movie, and I'd see him, and there was that little awkward moment. If you ask him, but he's not at the interview today, but if you ask him, he always had his eye on me. And then I spent a year in Israel. He spent the next year in Israel because he's actually a year younger than me. And when he came back, we re-met again, and that's when the romance started. But we'd actually known each other for years before. So, our kids find it quite amusing that you know, Dad had this from age 13. So, yeah, we met young. I guess we married young and started a family fairly young, although our youngest is actually 6. So he was born when we weren't as young, and our oldest is 20. So that's the spread.
It's amazing spread, but obviously they give you a lot of joy.
They do. I think that part of being a mum to my kids has given me the passion to help others. And I was telling the girls at Beth Rivka, which is where I was educated in high school. I spoke to some of the girls yesterday, and I said, one of the most amazing moments in my whole life was giving birth to my eldest. Her name is Priel, which means fruit of God. She was named in memory of my nana, who was called Pesha, and we were looking to modernize it and make it more Hebrew. But that moment of her delivery was just the most amazing moment, I think, in my whole life. And that was part of what clinched that I wanted to be involved in women's health, in obstetrics, gynecology, helping women. The fertility bit came later, and maybe we'll talk about that later, but being a mum and that privilege of my body bearing children and giving birth and having these children has fueled that passion to help others. I'm often asked, how do you balance it? And I would say being a mum also has made life complicated, juggling all the balls, and there are times where I feel like I'm just going to drop them all because it's too much, and I can't. And I think especially during COVID, one of the things I said was, I just can't juggle as many balls as I used to be able to, and I've actually learnt one of the good outcomes for me has been to take certain things down a notch. So post-COVID, I think life has actually calmed down a little because I've focused more on what's really important and let go of some of those extraneous things that maybe I had done in the past. But I think that having my children have helped fuel my passion to help others. And it's really one of the biggest blessings in my life. So, yeah, they keep me busy.
Yes. As a mother, I can concur with that one, actually. So you studied at Monash University.
That's right.
Is that where John studied as well?
No. All our education was completely, he was at Scopus all the way through. I was at Yavneh and Beth Rivka. I went to Monash. He was at Melbourne. There's a little bit of rivalry between Monash and Melbourne medicine, just a little. And he was also a year behind me.
Yes.
I actually was at uni because I'd been gone to Israel for the year before, so I deferred, and so I was actually in uni with a bunch of his school friends. And that was quite funny because they ended up being my uni friends. But yeah, we didn't study together at all. Our volunteering opportunities that came up, we did together, but otherwise we really had no overlap and no real rotations in common. I don't think in Australia we were ever at the same hospital. In Israel we had occasions where we overlapped much more professionally, but during our training we were at different teaching hospitals, different clinics. Even the coursework was quite different because the approach to medicine was Melbourne was sort of more traditional in those days, and Monash was a little bit more patient-centred and about communication. So we often joke about that, but I would suggest going to Monash if anyone's considering. But yeah, I'm very privileged to have gone to Monash, and I teach a lot of students, all sorts of rotations. They come to visit the hospitals. I'm one of the formal teachers and lecturers in the human sexuality course that we have for 5th years. And I often tell them about what I learnt as a Monash student, and I think that it was a great education, and I was really lucky, and I try to pass some of that on to my students, because in Israel some of the studies tend to be a little bit more sort of traditional, conventional, and I bring in a little bit of, I shake it up a bit and ask a lot of questions and get them thinking. But I think that was one of the amazing things about Monash and my education as a doctor here. So yeah.
Yes, because teaching is quite a different thing.
Oh, it's very different.
Yeah,
it's
you need to be conscious of it. I understand that.
Yeah, definitely.
Now, you practice in Israel. Did you need to do any further qualifications to be able to practice in Israel?
So
or is it a global qualification?
That's really interesting that you ask that, because when John and I studied medicine, it was a 6-year course.
Yes.
There wasn't a postgraduate course. There wasn't a 5-year course. And because the course in Israel is generally, there is a postgraduate 4-year degree, but most students do it as their first degree, and it's 6 years. So at the time that we moved, if you'd done a 6-year course, and if it was in a country like Australia, you basically gave them your paperwork and got your license. So we were really lucky, and that's part of why it was a good time for us to move.
Yes.
We both did internship here, so we got the full license, not just the provisional license. And then basically it was a wait. There was some bureaucracy, but we didn't have to do exams, and we didn't have to repeat like internships. So people who came after us and had done a 5-year course had to do either another year or repeat internship or do exams. And from many countries moving to Israel, the qualifications aren't recognised, and people have to go back a few stages. And we knew that if we came to Israel already as specialists, they might get us to repeat some of the training, like that might not be recognised.
Yes.
So it was a good time for us to go to start the specialty training there. And also, I think in retrospect, going at a fairly young age meant that it was easier for us to fit in terms of picking up the medical lingo. I mean, we both had reasonably good Hebrew, but not the medical vocabulary. Just settling in socially and professionally was easier at a younger age for us. So it's probably even easier if you study medicine there. But for us, we went at the stage that sort of made sense for us, and we didn't have to do any requalification or training. We both needed to improve our medical Hebrew. So we actually used to have a tutor that came to our house once a week, and we'd go through all the medical Hebrew. We both used to have, it was the olden days then, when we both used to have a little exercise book that we'd jot down the words, and I used to go on ward rounds. I'd be like, oh, what's that word? And sometimes it was an English word that they'd sort of made into a Hebrew word, and I was like, but that's not the real word. But slowly we picked it up, and some of it you needed to be on the ground. You couldn't learn it from a book.
Yes.
We needed to have these conversations with our tutor, and that was great, and to get into the work there. But we actually had no retraining, so we were really, really fortunate. Made it a lot easier than I think it is for many people.
Wonderful. You're very fortunate. Yes.
Very, yeah.
Now, I believe you did some studies also in Canada.
I did, yeah.
What took you to Canada? And did Jordan study there as well?
Okay, so I did my obstetrics gynecology training in Sharee Zedek. So basically we moved to Israel in February. At that stage, we'd made contact with some of the departments around Israel, but we didn't know where we were going to live, and we didn't know where we were going to work. And it sort of, the first 6 weeks we had lots of meetings, interviews, and it came together that we were both going to work in Jerusalem and start our specialty training there. And we already started in June. So, came to Israel February, started work in June, was pretty quick. And the obstetrics gynecology program in Israel is 6 years with 2 exams in it, similar to what it is in Australia. And I had two of my children were born during the training, so I had 2 mat leaves as well. So it probably took me closer to almost 7 years to complete that training. And after that, once I decided I wanted to go into the direction of fertility, infertility, IVF, a lot of the doctors that want to go into that field, it's very competitive, and a lot of the doctors go for a fellowship overseas to get specific training in fertility and IVF. Although Israel is one of the best places in the world to go through treatments, it's kind of a way to broaden your experience, see how it's done in another culture and another country with different cultures, because in Israel, especially in Jerusalem, in Sharee Zedek, we see a lot of the same type of people. So it's kind of a broadening experience as a doctor to do a fellowship overseas.
Yes.
And that was the path that I'd chosen. And interestingly enough, we actually considered coming to Melbourne for
Makes
the
sense.
subspecialty.
To see your families.
And well, we had a trip here, and I presented some research both at Monash and Melbourne IVF, and at one point was offered a job, but we decided then that for our family, which then consisted of us and 3 of our children, we decided that Canada was going to be a more broadening experience, and that actually being in a community where we don't have the family and friends would give us a different sort of open different pathways for us to grow as a family, because we didn't have anywhere to go for bagels and brunch on a Sunday because we didn't have relatives or friends to go. I mean, we had a lot of friends by the end of that time there, but we could go on family trips and we could do a lot that was just our nuclear family. And I think after the harder years of the specialty training, which were very difficult years with a lot of night shifts, there was a time in our career where John and myself were doing between us 15 night shifts a month. So we were barely in the same house. And that was the hardest time in our training, but they were really hard years. And Canada was an amazing opportunity, both professionally, but also for us to have some time, just our family. And because Canada's we were in Montreal, yes. So part of that is French speaking as well. So it was really an eye-opener and an opportunity to learn about a different culture and community and the medicine there, which is actually, Montreal's quite similar to Australia in terms of the Medicare, in terms of the public system there. And it was a great opportunity for the kids. The kids all learnt French. By the end of the time, my daughter in the school play, it was actually Annie, and she was Grace Farrell in French. And she came out in this suit with a briefcase and spoke beautiful French. And she's stuck with the French, actually. But they learnt French. They improved their English, they made new friends, and that experience sort of stayed with us. And it started with a connection that there was an Israeli doctor at McGill in Montreal who I wound up having coffee with in Jerusalem, as these things happen, who invited me to come on the fellowship after I'd explored Australia and England and other places in Canada. It all just sort of fell into place. So really our experience in Montreal was for my fellowship. John wound up on his own path entirely. He's a family doctor and originally was going to work training the family doctors there, but then they told him that he would need French qualifications, which would take over a year, and we were going for 2 years, and he ended up working, it's amazing how things just evolve, but he ended up working with a company that basically then were doing training, like online courses and training in medical areas, both for the army and for medical and nursing students, and he became their medical editor. And then ended up working with them in sales and travelling, and actually, well, I'll talk a bit about Africa further on, but later on down the track, some of the courses that he was involved in writing and editing, he was able to take and donate basically to one of the hospitals in Kenya that he later volunteered in. He was there with a Canadian, and they set up for the hospital there a whole teaching program based on the modules that he'd written. So it all just sort of fell into place. But Canada was a great 2 years, and actually my 4th child, Hillel, was born in Canada, in Montreal. So he's actually our little Canadian. He loves it. We were at a Canada-Israel ice hockey match recently, and he got all dressed up in his Canada gear, and he loves telling people he's Canadian. He's actually triple citizen, Canada, Australia, Israel, because all my kids are Australian citizens as they're born of Australian parents. But they all have quite an Aussie identity as well. They follow the footy with my dad, who is a Blues supporter, I have to say it. They know all about it. They're quite connected to a family in Australia and know quite a bit about Australia, given that we are both Australian parents. So, yes. And Hillel particularly has this Canadian feeling about him. But everyone had really a great experience there. And professionally it was fantastic, and I was involved there in research that then continued when I came back to Israel, and I've actually retained some of those connections that were made there, and with some of the doctors. One of the doctors was in Israel couple of months ago, we had dinner together. We talked about all sorts of professional and personal, because I was there, I think, before her two daughters were born. And it's a real eye-opener. And I'm actually still connected to one of the professors at Melbourne IVF that then interviewed me, and I presented way back then to her unit. I've seen her at conferences and we stay in touch. And that's been, it's great to have these connections.
A shared passion.
Yes, definitely.
I'm fascinated by your choice of going to Canada when you knew it was going to be a challenge. You had no support.
That's right.
And yet you recognised that was going to bring your family closer together, yet put more pressure on you and John.
Yeah.
Wow.
There was a lot of thought that went into that.
Yes.
And at the time, the kids, when we went, were 9, 6 and 4. And we actually, we had a lot of considerations, and at some point I just said, we're going to make a spreadsheet, and for every person in this family we're going to go through the options, and we really did it for each of us, the 5 of us. Well, for John and I, the professional opportunities, the family opportunities, how we thought it may affect each child. Yes. And in the lead up, we actually went to a counsellor to talk about the kids, how to prepare them. We started with exposure to French 6 months before. So we used to watch just like French cartoons. Yes. So they heard a little bit of French and got used to it. And we tried to prepare them. And we thought about how is the transition going to be, because these kids were used to life in Israel. And we actually prepared them. In the end, the kid that we thought would have the hardest time obviously had the easiest time. It was really quite an upheaval, uprooting them, putting them in a place with no support. But I have to say that the Montreal community really reminds me of Melbourne in terms of the warmth and that community feeling and the amount of just goodwill and energy and support offered by their community. And we had an amazing 2 years, and we're still very close with some of the families that we connected with, and some of my kids are still in very close contact. The kids of our friends are now coming to Israel for a year, and they come to us for Shabbat, and we go out for burgers, and when the parents come to visit, they come to us for Shabbat, for Yontif, and we're still in touch with quite a few families. And I think we both have a very soft spot in our hearts for the Montreal community, and we often said how much it reminds us of Melbourne. And I know a lot of doctors that have also come to Melbourne, Israeli doctors who've come to Melbourne for their fellowships and have had a wonderful opportunity. And one of the similarities is that they also have a high proportion of Holocaust survivors, like we do in Melbourne. And it may affect that close-knit community feeling and that warmth and that ability to reach out and really welcome people in. So we found it an amazing experience, and despite what we were concerned about being difficulties, we took the plunge, we took the challenge, and it was an amazing 2 years.
It's incredible.
Yeah.
So how old are your children now, and do you think any of them are going to be doctors?
That's a tough one. So my oldest, who was born here with the inspiring birth, she's 20. And she is a soldier in the army.
Yes.
And I think it would be unlikely for her to be a doctor, but she may surprise us,
Yes.
because young people in Israel are not doing their year 12 or year 11, and they're not very focused on what they're going to do when they grow up, because even though they have to grow up quickly because they go to the army, their studies are going to commence way later, and they go through a lot of changes. So my daughter, who is a musician as well, and she did music in year 12, year 11 and 12. She was in a jazz music school as part of her year 12, and also did like a mixed philosophy, like very, very like philosophy, literature, history focused. Could decide to study medicine, and in Israel you just add a few subjects and do them, and you can transfer. But at the moment, I don't know what she's going to study. We'll see where we get to, but she's only going to start uni maybe aged 23, 24 by the time she had a year after. She actually planned to go overseas for a year after school, and give to a community. She was supposed to actually go to South Africa or Canada, and because of COVID everything got cancelled, and she didn't get to go, but she wanted to go and teach Zionism in schools for a year, because when she was in Canada, the shlichim that were there, that were coming from Israel to teach Zionism and Judaism, gave her that support and that extra push. She saw what they did. She wanted to do that. Because of COVID, that was all cancelled. And she spent a year in Midrashah or seminary studying her Judaism on a deeper level, and then went into the army. And she's going to finish the army age 22. And the typical path in Israel is to then work for 6 months, go and travel for a year, and then they finally decide. So it's hard to know what any of them are going to do. But she's my oldest. My son Tzvi is 18, and he's going to go into the army in March, and he's doing a pre-army training at the moment, which is, I guess, both physical and mental and emotional preparation for army service. He is a master debater. Actually, he represents Israel in the World's Debating Championships, and he's just brilliant and amazing and a real speaker, and don't think he's going to medicine. But my next one might. So the next one is Elon, who's 15 years old, who volunteers. He's a leader that works with kids with special needs, and he's a very compassionate and thoughtful and warm, sensitive kid. And he may have maybe the path of medicine, but I don't want to put it on anyone or say this is their path.
No pressure on.
He might be the likely candidate, but and then Hillel, our Canadian's 9. I don't think he'll go the doctor route, but you never know. I don't think I would have. When I was 7, we had to write what would be when we grow up, and I wrote, I want to be a dentist because I like getting money from the tooth fairy. Well, that didn't translate into a career as a dentist, but so kids are kids.
Yes.
And then my little one is called Lavi, and he is 6. Lavi means a little lion, like a lion cub, and he's just a darling. But I don't know. I don't know where he's off to in the future either, but
it's early.
But it's definitely too early, and neither of us were particularly encouraged to do medicine. It was a personal choice, and John and I both made a lot of personal choices, both about our career and our religious observance and our Zionism. We were given a lot of freedom to make those decisions as individuals and as a couple, and even though I bring up my family in an observant home, with a whole lot of values that we try to share with our family, I really think they all have to find their individual path.
Yes.
And studying medicine is really hard, and you have to be committed and passionate, and I don't want to push anyone to do it, but you never know. And as I said, in Israel, a lot of people make changes after they've done the army. They suddenly decide they're going to go this path or that path. So they're coming at it at a more mature angle with more life experience than maybe your typical 17, 18-year-old here that has already decided in year 10 the subject so they can get in and get their TER. So it's a bit of a different, I guess it affects their personal and study choices coming into it at such a delayed age for the good.
I think it's wise.
For both, there's 2 different angles to it. But
yes. Now, before we move on, I'm just curious because I think a lot of people will be watching this and be very impressed with what you've done and your amazing children. Childcare, I have to ask, how have you done all of that?
A lot of help.
From whom? When you're in Canada, you had no one.
When we're in Canada, I think I would say Canada was one of the easy periods because all 3 of the kids were at the same campus. So we had, Elon was in kindy there, and the 2 big ones were in grade 2 and grade 4, and then the next year. But it was the same campus. So it was, I know that young parents here that have, my niece and nephew, one's at this campus, one's at that campus, there are different drop-offs. So being able to drop off and pick up at the same campus at the same time already made it easier, and it was a 5-minute walk from our house. So it was really close because we lived in the community and really close to school. The other thing that's amazing about Canada is that kindy went, if you wanted it to 6 p.m, and I think it was $7 a day. It was heavily subsidised by the government then, and included 3 meals, and they were really trying to encourage working parents. And in Montreal specifically, there are a lot of rebates for childcare. Even people who have a nanny in the home get rebates on it because they really want mums to be in the workforce. So they subsidised childcare very heavily. But at that stage, they were at kindy, grade 2, grade 4 in the same school. It was called Hebrew Academy. And because John was with a computer a lot of the time, some of his hours were flexible. So I think that it was the time in our lives where actually his work was quite flexible, which enabled the day to be less stressful. We had some help with some of the cleaning, but otherwise we didn't have that much backup. And if I needed help, I had a few friends that, I became friends with that along the way. I needed help with pickup or with a sick kid or with something. But really there was a certain amount of flexibility actually in that bubble of a life in Canada. We had a little bit more flexibility than probably our lives in Israel. There were less demands on us in terms of our day-to-day. So even though we didn't have that network of support that we had in Israel, and at that time my parents were living in Israel as well.
Okay, so you had them to help
That was Israel though. In Canada we didn't have that, but somehow I think life was a little easier for us to navigate those challenges because John was more hands-on and had a bit more flexibility. But I'll have to say that throughout all of the years, John is an amazing support. He's not a typical person, but he's also not a typical dad.
Yes.
I'm away now and he's managing the home, but I know it's all fine. John can cook and he knows where everyone's clothes are and he knows what everyone's timetable is, and he's a really hands-on dad. And even
kudos to John.
Yeah, even when, there've been night shifts and calls out, we are always in touch with the kids. We'll always phone in and have a chat and touch base.
Yes.
And I don't think I could have done any of this without John.
Yes.
Because he's always believed in me. And at the certain points in my career where I thought, oh gosh, how am I going to keep going? How can I keep doing night shifts and have these little babies?
Yeah.
How? And John was the one that said, this is you. You need to be a gynecologist. You need to help women. And he really supported me. But for the younger people out there thinking, oh, how do you do this? It was tough. There were what we say were the lean years. There were the tough years. And I think for any couple with young kids and a career, doesn't matter what that is, that work-life balance is a huge question. Yes. And I think one of the things that got me through it was knowing that these were temporary phases. Life wasn't always going to be this crazy and demanding. And trying to appreciate those precious moments when the kids were small and trying to just take a little bit of time out, even though it wasn't always enough or at the right time, but just appreciating the precious moments.
Yes.
And when I'm with them, to be with them.
Yes.
And I think that's relevant no matter how old our kids are, to be able to make the time where we can listen to them, where we can be present and when we can enjoy them. And of course those years fly by, and I think that as I became my younger two were born, I would consider myself an older mum then compared to the young mum with the first ones. With my younger boys, I think my sense of appreciation for these children as the blessings that they are, but also knowing that it goes so quickly and you blink, I think I appreciated the moments even more with the little ones because I knew how quickly those times pass.
Yes.
And I remember when I had Hillel in Canada, and my older kids were big by then, and big. They were 6 and 8 and 11, but they were bigger. I used to go out without a nappy bag, without a pram. How are you going to have another baby? And it was actually so easy with him. He was a fantastic baby, but also I think I so much appreciated the precious times that maybe with the first ones, I kind of, lived through it, but it was all such a blur. I mean, with my younger ones, I just held the moment a little more. And I think that's something that all of us, no matter what age and stage we are, in today's day and age, holding on to the precious moments. And I'm grateful that I have Shabbat in my life because Shabbat for us, unless I'm on call and then I leave my phone on, and we do sometimes have neighbours or people knocking on the door with medical questions. And at a Rosh Hashanah meal, my husband had to go to help someone, a cancer patient with their drip, one of the neighbours, and I've been called to check women. But in general, we have no communication with the outside world. The phones are on silent.
Yeah, it's
We're just with our family. And I think Shabbat has helped us get through all of this because we have that precious time where nobody's on their phone, where we have to be around the table and just talk and enjoy and celebrate that togetherness. So I think that's been a real anchor for us. And it was in Canada as well, that family time where it was our family and that precious time, because I think a lot of people nowadays don't get that. So I'm grateful that we've established our lives like this and that Shabbat's a big part of our life.
That makes complete sense, actually, based on the pace of your life.
Yes.
Now, your specialty is fertility. What are some of the main issues that cause fertility challenges? Okay, so fertility problems are really common. They're more common than we might think. Somewhere around the 12-15%, so about 1 in 8 couples will not achieve pregnancy when they want to. And fertility or infertility means a year of trying and not getting pregnant. Yes.
Although we might start checking things out after 6 months if a woman is 35 years or older. And one of the big challenges today is the age at which women are starting a family. So fertility declines with age from the mid-20s, pretty much all downhill in terms of the quality of our eggs and the chances to get pregnant. And unfortunately also the risk of miscarriage increases with age, and that's because of the quality of a woman's eggs in relation to her age. So there's a social aspect to fertility that is connected to the age at which women are starting a family. And one of my missions both here and in Israel is educating teenagers not just about safe sex and contraception and sexually transmitted diseases and issues of consent, which I think are all really important, but I think they also needed to know that fertility issues are common and that fertility has an age component. But in general, fertility might be connected to something to do with the ovaries, either not producing eggs, not producing high quality eggs. There might be problems actually with the uterus or the tubes that are either blocking the implantation of a fertilized egg or actually not allowing the sperm and egg to even meet if a woman's got blocked tubes because of surgery or because of a burst appendix when she was 10 years old that might have caused some sort of damage or scarring. We're seeing more and more problems with male infertility, which there are all sorts of theories about the environment and our diet and what's happening, because actually the World Health Organization every 10 years or so brings out a revised criteria or classification of what are normal numbers for a sperm count, and it keeps going down. So that means normal keeps getting lower and lower. And I spoke to one of the people in charge of one of the big sperm banks in Israel, and they said their criteria for donor sperm, who's allowed to donate in terms of the numbers, there are more and more men that are not even able, people who want to come and donate sperm for women who need it, they're having to reject them because the numbers just keep declining. So we're seeing more and more male infertility. There are people that come for treatment because of a genetic issue. So they might be carriers for some sort of genetic mutation or disease, and they come to fertility treatments so that they can have a baby through IVF, and we're able to test an embryo and then only put back a healthy embryo. So they might not have actually a fertility problem, but they're needing our services to be able to have a healthy babies. But I would say most of the people coming for IVF, in vitro fertilization, have been through a lot of treatment with hormones or inseminations, all sorts of treatments until they get to actual IVF, which is what we do in the hospital, which involves hormonal treatment for the woman with daily injections, collecting the eggs, which is usually done under general anesthetic. Then it all happens in the lab, so there's the fertilization of those eggs with the sperm. And then we grow the embryos in the lab for 3, 4, 5 days and put 1 or 2 back into the body of the woman, into the uterus, and the rest can be frozen for future babies. So couples sometimes have gone through quite a journey before they get to IVF. They might have been trying for 6 months, a year. They might have been trying for longer. They may have discovered that they need IVF for genetic reasons. They may have been through a whole lot of treatments that haven't worked, but there's definitely a lot of expectations and a lot of disappointment that they've already been through, and it's a tough time in a couple's life, and some marriages actually don't survive it, and unfortunately we're sometimes left with embryos from couples who've been through treatment and split up, and then they don't belong to anyone, and we're stuck with them. But it's a real challenge, and I am all for making the experience as not easy, but trying to take care of all the couple's needs, and not just giving medical treatment, but offering support. I'm very into mind-body medicine, so anything holistic that we can offer, we have at our hospital in Sharee Zedek: acupuncture, yoga, art therapy. We have a lot of psychosocial support. We have groups like support groups.
Brilliant.
I'm trying to set up a music program for women about to undergo a procedure to have music and relaxation that they can listen to prepare them before they actually go into their treatment. And I think being able to give support beyond just the medical treatment is really important, because it's a time of intense challenge where a lot of couples feel very alone. A lot of men feel really alone. And there's actually support groups specifically also for men, because sometimes for men discovering that there's a problem with their sperm, or that they might need donor sperm,
Yes,
for their family,
confronting.
that can be really confronting and really difficult for them in the way they see themselves as a male, that they consider themselves virile and masculine, and then we're saying, well, actually there are some problems with your sperm numbers, and some men say this is the worst thing I've ever heard, because it's a real challenge. So how to tell couples what's going on, how to tell them perhaps bad news, that we don't have an embryo to put back, them discovering that they are not pregnant. So there are, although I would say in general my work is really rewarding and positive, and most couples will get a baby at the end, it can be a long, challenging, difficult path to get there, and it's a privilege to be involved in that work, and the biggest privilege for me is then to look after these women when they're pregnant afterwards, and deliver their babies and see them for the next baby. And I consider that I'm involved in a really crucial and special part of these couples' lives, and some people say, I don't know how you do this kind of work, because there's so much emotion, and it's really difficult, but I feel like it's an immense privilege to be able to help and be part of this journey. And you know what, sometimes I cry with my patients.
Yes.
And more often we celebrate, and it's a real privilege to be part of that journey.
Absolutely beautiful. What got you into the interest of fertility? Is it your own family?
So it's interesting, because I think I got to obstetrics. I always loved women's health, and when I did my rotation in obstetrics, I actually, in those days, they let medical students do deliveries, and I had really great training in O&G, and I after the exam, myself and some of the other students that had excelled in the obstetrics exam got invited in for a chat with the head of obstetrics and given a kind of pep talk, and I always loved it, and I worried about how I was going to balance it with kids, because I knew I wanted to also be a mum. And I think having kids really helped me decide that this is what I want to do to help other women, and has helped my passion to help women with fertility problems fulfill their dream of being a parent, because I think it's such a fundamental part of me to be a mum, that I want people to have the opportunity to have that in their own lives, and I want to be able to help as many women and couples as I can. So while that has been, I guess, the wind and the energy behind me that's given me that passion to keep going, I got into fertility almost by accident, because when I was doing my training in obstetrics, I always thought, I'm going to deliver babies, labour ward, this is where I feel comfortable. I love delivering. When I was a student, that was for me, obstetrics was all the deliveries and all the buzz and the high, and again, being part of that special intimate moment of the baby, being the first person to touch this precious baby. It was a real buzz, and that's what I thought. That's where I thought I was going. And then one Friday. Friday's kind of a half work day in Israel, but I got invited to this one-day conference, and it was actually about testing, the genetic testing of embryos, which I alluded to earlier, and it was about not specific diseases that they were testing for, but changes in the number of chromosomes or the genetic makeup of these fertilized eggs or embryos. And I was at this day, one of my mentors just said, come along, I'll give you a lift. I didn't know what I was getting myself into. And I was at this lecture, and they were talking about research where they tested the embryos after 3 days in the lab, and then they retested at 5 days. And it was this new research that showed that some of the embryos that tested abnormal on day 3 self-corrected by day 5. And I was gobsmacked. And it was this eureka moment where I just thought, this is amazing. You know, that means that until now we might have been chucking out healthy embryos. And it just got me into this whole field of fertility. It just got me. Yes. And I got hooked. And as I worked more and more in fertility, I found that I really loved it. And that it sort of allowed me both the intellectual side of planning the treatment and balancing the hormones, and that very human, compassionate side of being part of that journey, as I mentioned before.
Beautiful.
And I never imagined that. That wasn't what I envisaged when I started obstetrics training, but it just sort of, I fell into it. Or I just was at the right, it was the right place at the right time, and it was my eureka moment, as I say, and I just knew that was the next stage. And I got very involved in research, and they let me open my own clinic, which was very unusual at that stage of career because I was still a registrar. I wasn't fully trained. I had my own patients, and the more I was involved, the more I got into it, and I wanted to learn it, and I wanted to help, and it just seemed to be a great match for my passion of parenting, and I guess being a mum gave me that extra energy to keep going in the harder times, knowing that I was helping other people create families.
It must have been quite, I imagine, difficult for you, knowing you wanted to help other families have family, but you weren't with your family because you were so busy doing this. But it was obviously such a push for you to help others that was okay. And you knew John was home caring for the kids, assisting.
So besides John in our lives in Israel, we have my mum and dad who live very close by and came to Israel almost 17 years ago. So the early years they weren't there, but since they've been in Israel, they've been also amazing support. And we have a really wonderful community of friends around us that also support us. There have been difficult times, as I mentioned. Yeah. And I haven't always felt that I'm there for every single thing of my kids. And I haven't always been there. And I don't think I'm the perfect mum. And I don't think I'm the perfect doctor. And it's always been a struggle. Yes. And as I said about the juggling, it's not easy. It's been a challenge. I have
no doubt. And I want to commend you because you are helping so many people. But I want everyone to be aware that you are also giving of yourself in more ways than one.
So the older kids actually my daughter asked me recently, what price did you pay when you were studying? Because as I said, her friends are at the stage that they're in the army, they're thinking about their future. Everyone knows that Priel's mum is an IVF doctor, and I'll get all sorts of interesting questions from some of her friends. And they're thinking about what might they want to study, how will they balance it. And I'm not saying it's all easy, it was all, hunky-dory. It wasn't. And we had a chat about some of the things that maybe I wasn't there for, and we had a hug and a bit of a cry together.
Yes.
And I think that balance is the key, and that we've all got our own energy levels. John and I have always been a high energy couple with a feeling that we want to give. And as John said very early on in our relationship, make the world a better place and contribute and do our part. And that's also been part of our education to our kids,
yes.
Both with our career path and also different volunteering that we've done with the kids. And I often talk to them about being proud of what they're good at and what they love, and that I hope that they all find a way to make their lives and work meaningful.
Yes.
Because if you do what you love, then it's not work. It's your calling. It's your passion.
Yes.
So not everyone finds that, and some people find it much later in life. They might start off doing one thing and have a second or even a third career. One of my best friends, who's Australian, has started studying nursing now.
Wow.
As a further career, and she is amazingly committed. She's juggling that with raising 4 beautiful kids. A lot of people only find that niche or their calling much later.
Yes.
So for me, it was clear very young.
Fortunate.
But I hope the kids will all find it in their own ways, as I've said, as
Yes.
in their individual paths.
No, it's wonderful. I commend you very much. Now, schools are teaching our children about contraception, safe sex, avoiding sexual diseases, and you were talking about the diminishing number of sperm and eggs that are becoming acceptable even in science. Is that are you seeing more and more patients as a result of that?
That's an interesting question. So we're seeing in general more male infertility in terms of the sperm numbers, and I would say that the average age of some couples coming for IVF treatment is getting higher and higher. But I think at least in Israel, and also from talking to some IVF specialists here, women are realizing that age has an impact on fertility. And whereas it used to be that single women in their 30s, let's say, had to either not be a mum or be a mum with donor sperm, now we have an option of women freezing their eggs at a younger age, which can then be frozen for many, many years until they make a decision to start a family, until they meet a partner. And that's something that I want girls to be, young women and girls to be aware of as well, that it is another option that they can do something active about their fertility. And interestingly enough, it's becoming more and more acceptable in the religious, Orthodox, observant world, both in Israel and overseas, that this is an option that young women should be considering if they're not in a relationship, because not everyone finds their Mr. Right at the young age of 23 or whatever, or 13, 14. Not everyone finds their partner, or some people go through a divorce and then they have a second marriage or whatever, another relationship down the track. You know, obviously biologically, the best thing to do would be get married as young as possible and start a family, and that doesn't always work.
No.
And people don't always find the right partner, and they might not wind up with a partner, but not everyone is ready to be a single parent. So egg freezing, which is an option also in Australia but also in Israel, is getting more and more popular.
What age would you be recommending that?
So in Israel, there's a minimum age, and that's 30. So below the age of 30, unless there's like a medical reason, like I see a lot of women with cancer that are about to start chemotherapy, and we freeze their eggs because we have to, because the chemotherapy can destroy their fertility. Yes. And that in itself is another whole niche, that part of my work that is kind of a ray of hope during this whole time that the family's going through all the devastating news about the cancer and the cancer treatment. So that would obviously be an age group that we offer at much earlier.
Yes.
And there might be some genetic reasons why women need to have their eggs frozen earlier, if their ovaries are aging rapidly, or so there could be a medical reason. But for non-medical reasons, we do it from age 30. I would be encouraging young women to be aware of their cycles and aware of their fertility, and even going just for a fertility checkup, even if they're not planning a family right now, so that they can make better choices.
Oh, they can do that.
Yes, they can go and have blood tests, ultrasound, a consultation, so that they know what is their fertility likely to be like. Now, as I've said, they might have blocked tubes. They might wind up with a partner with terrible sperm count, but at least in terms of knowing their own bodies, I believe knowledge is power. And I think women should be aware if there might be any fertility red flags to be aware of. So I think that's part of the awareness. I think they need to hear it in schools, and I think young women need to hear it later. and know that it's not just about preventing an unwanted pregnancy.
Yes, it's the other side.
And taking control and protecting ourselves from sexually transmitted diseases. And I think issues of consent is a huge thing to be educating the young people. And I talk at my kids' schools about it. But I think they need to know that fertility is a common challenge, infertility, and that it's not just let's try and we're going to get pregnant, but a lot of couples have troubles along the way. And some of those challenges might be circumvented by women, let's say, freezing eggs at a younger age. So I'm quite passionate about educating the younger generation.
That's so, I never thought that our daughters can have checks to check their fertility. That's very interesting. Thank you. Now, what support do you think that couples going through fertility need? How can we support people we know going through it?
So it's really interesting because part of what I've talked about while I've been here is fertility like something that's private, just between the couple, or should it be something that is dealt with as a community? You know, people get meals made for them after a baby or after a loss, but they don't necessarily get meals made for them while they're going through fertility treatments and not sleeping, and their body's pumped full of hormones and they have painful egg collections. A lot of times people are doing this alone because it's so private for them, or because people don't want to hear and don't want to know and don't want to ask.
Yes.
So there's this kind of stigma or taboo around fertility, even though it's so common. So I think, number one, we can talk about it. Number two, we can offer practical support and advice and help if we can. And there's always this fine line between, am I interfering or am I supporting? And sometimes something like, I know you might not want to talk about it, but I just want you to know I'm here. Or I'd like to be able to help you. What day can I make a meal? Or can I do this for you? I go at it at a more also spiritual angle. You know, what support can I give you? Do you want to go and see a concert? Do you want to go and, you know, do something have a walk on the beach?
Yes.
You know, a time out that you're not even thinking about it. And I think it really depends on the relationship.
Now, you've done lots of volunteering around the world, which is very impressive in itself. But what are some of the lessons, or what are some of the things that sit with you that you have seen and learned from your volunteering experience?
When I think about what has inspired the volunteering work, I go back to John and my early days of how we're going to change the world together, and also as individuals. And we were very privileged to, as medical students, do quite a lot of volunteering in different communities in far north Queensland, in Bamaga, as John was the recipient of a scholarship to go there every year for 4 years. And we both received Commonwealth grants to go to Africa as students. So we were in Kenya and Zimbabwe for 6-week electives at the end of our 5th year of medicine. And I think that inspired us to continue volunteer work later on in our careers. But back then we were a young couple, and one of the challenges, and something that has been, I think, the highlight for me in all of our volunteering opportunities, has been what I've done with our kids. So besides John going to Africa several more times, to Kenya and Sudan, and now he's involved in a project in Uganda where he'll be going back and forth regularly. We started from a young age doing different sort of volunteering opportunities with our kids. But I think when I had to educate and do it practically with them and see it through their eyes, that was a big eye-opener for me. So when we lived in Canada, we had regular volunteering with an organisation similar to C-Care, which involved packaging meals, cooking, taking meals to elderly people in an old age home, chatting to the people, and that was something that we did as a family. And one of my kids found it particularly challenging and didn't like going to meet the old people, and for the other two at that stage, they loved it. And we had to balance that and find a way for him to feel more connected. And a few years ago, we volunteered with an organisation, Gabriel Project Mumbai, which is actually run by an Aussie, Jacob Stockman, who lives in Israel. And we were in India as a family. And John and I got to volunteer as doctors. teaching in the communities, giving lectures. I ran these obstetrics clinics where I had pregnant women with all sorts of complications, and they lined up literally out around the hospital to see me for the day that I came to their district. And we did a lot of training at the time with our children who were, it was 3 years ago or even more, pre-COVID. Our little ones were actually in creche and kindy there through Chabad. We were really lucky, and the big kids got to volunteer. So they worked in schools, they taught kids English, and they also worked planting rice and cooking and helping people. And I think that what stayed with me and what gave me so much joy and nachas as a parent is seeing them joining us and making volunteering part of their lives. And they've all chosen their own direction. So Priel, my daughter, the musician, used to play with a band regularly in hospitals, for kids with special needs, in old age homes. They'd go and put on these concerts, and she also used to visit with elderly people, especially she tried to use her French with some of them, and they've each been involved. My son Svi was involved in delivering meals. At the moment he does sort of farming volunteer work with farmers. Him and a bunch of friends have gone up several summers to help. One year they were picking blueberries, another time they were repairing a fence, like whatever was needed. My younger one works with kids with special needs, and they've all found a way to do that. And as a parent, seeing my kids doing it is even more meaningful than doing it myself. And I think it's a big part of our education. And what I'd like to say to the next generation is to find a way for you to help and a way to practice what is known in Judaism as tikkun olam, which is literally fixing the world and making the world a better place. So I think that we all have our unique way to contribute, and I hope the next generation will find their unique way. But what stayed with me is really looking on with nachas at the kids doing their bit, and that gives me probably greater pleasure than volunteering myself. And I think that most of the time it's so humbling. As a gynecologist, I was allowed in the homes of women in India. We did like home visits as well. And I sat on the floor in these little shacks, the size of maybe a bathroom or a laundry in Caulfield standards, with one pot and one burner and not always running water. And I asked these women, what would you change if you could change something? What do you want for your kids? Some of them want to know they can rely on electricity. Some of them want clean drinking water. For some of them, their dream is to be able to have enough money for their kids to be educated, but none of them complained. And they all had this joy in what they had and this appreciation of all the good in their life. And I remember feeling very humbled to be firstly allowed in their homes and to have this sort of inner glimpse, because as a doctor, they let me into their homes. And they talked to me. But I also felt so humbled that these people with literally nothing to their names, or very little in terms of material possession, had such joy and such appreciation of the little blessings. So I guess what stayed with me is to be able to appreciate the simple things and to know how lucky we are, and that everything that we can do will make a difference in someone else's life.
Jordana, what does the Jewish community mean to you?
The Jewish community for me is about warmth and support and being there in times of need and to celebrate, and Judaism being fundamental to my life and to the life of my family.
Beautiful. Thank you so much for
My
allowing
pleasure.
us to interview you for the Social Blueprint. It's been such an honour to be able to speak to you and keep up your wonderful work.
Thank you very much.
And thank you to your husband and children who
Yes,
supported
thank you.
you.
Yeah.
And what an amazing woman. Thank you very much. And
Thank
everyone,
you.
please go to thesocialblueprint.org.au to enjoy this and many other interviews.